The board of the African Development Bank, AFDB, rose from its annual general meeting with some decision on financing Africa's COVID-19 recovery plan. And the upsurge of COVID-19 cases in some African countries, especially South Africa, is defying efforts at curtailing the spread. Now, these issues are our focus on this week's edition of the program. I am Joyce Ikogu, welcoming you to Africa Weekly. The AGM of the Africa Development Bank has come and gone. Now, this report highlights some major decisions reached at that meeting.
The African Development Bank Group is a financial institution established primarily to promote the social and economic development of the continent. The bank was founded in 1964 and comprises three entities: the African Development Bank, the African Development Fund, and the Nigeria Trust Fund. The bank's shareholders and officials from across the globe met in Abuja, Cote d'Ivoire last week for talks that centered around Africa's economic recovery and COVID response.
Welcome to the 2021 annual meetings.
Setting the tone for an ambitious week of talks, the bank's president, Akinwumi Adesina, brought to the four issues affecting the continent as a result of the outbreak of COVID-19.
Africa faced its worst economic recession in over 50 years due to the COVID-19 pandemic. As a result, Africa's GDP declined by 2.1% in 2021.
The bank presented what it terms as the African Stability Mechanism with a liquidity and sustainability bailout facility to provide instant emergency funding to countries.
One potential area for high returns on investment is acting to lower what economists call trade costs, the costs associated with moving goods from the factory gate to the final consumer. This would raise the productive capacity of African economies, ultimately reducing real debt burdens, while helping build regional value chains and increasing the global competitiveness.
In Nigeria, we'll be making a lot of effort to, on a quarterly basis, disclose all the debts that we are borrowing and also to indicate what the debt service is.
Before the coronavirus pandemic, Africa was home to 6 of the fastest growing economies in the world. This changed as economies went into lockdown, travel was restricted, tourism dried up, while commodity prices plummeted because of weakened global demand for exports of oil, gas, and commodities.
Now, joining us via Zoom is Professor Oyeyinka Oyelaron of the Africa Development Bank to discuss these issues. Many thanks for joining us on the program, Prof.
Thank you so much for inviting me.
Now, one of the major fallout of the AFDB AGM was the talk about Africa's Stability Firewall. What is this about?
Thank you so much. The firewall is what we have called the Africa Financial Stability Mechanism.
Right.
It's a regional guarantee emergency support that will complement existing architecture, financing architecture, and to provide needed fiscal space for countries that are in distress, those who are falling into illiquidity, those who are insolvent, and to limit regional spillovers. It will protect the continent from financial crisis and help resolve those that have emerged already. So we are working, that is a complement to the global safety net that IMF already has. As we call it, the AFSM, the African Financial Stability Mechanism, is an idea that was proposed by Dr. Adesina and has now been agreed by all the key stakeholders, all the central bank governors of Africa, the global players.
Absolutely. Now, the AFDB is worried about the seemingly divide in COVID-19 recovery stimulus for the rich and poor countries. Why is this an issue?
Oh, yeah. Vaccine nationalism has been an issue for us. As you know, we have huge problems in terms of health, the health metrics. Let me give you an example. Only 51% of public health facilities in Africa have basic water, sanitation, and electricity. Only 33% have care facilities.
Right.
Africa has 21% of hospital bed per density.
Right.
And what we find during this COVID is that suddenly we cannot even buy vaccines. As you see now, only 2% of all the global vaccines come to Africa. We have right now 200% more deaths after surgery than the global average. So apart from the vaccine, we have persistent health issues that is going to still be with us even after we have dealt with the pandemic as it is. So it's a big problem. We import virtually 90% of our drugs from India and China.
Right.
We import vaccines, which we are not getting now because other countries need their own vaccines. A lot of the big powers have vaccines. Some have 4 times what they need. So what the bank is proposing and what all the African heads of states are proposing, that we should have domestic pharmaceutical manufacturing in Africa.
Right. Now, Prof, the global financial architecture, which is not in favor of Africa continent, was also discussed. What is the AFDB pushing for?
No, this is one of the reasons, for example, for the Africa Financial Stability Mechanism. It's going to do a number of things for Africa. Number one is to support African countries with temporary balance of payments management. The second one, of course, is to help those who are illiquid and are probably going to insolvency, and also having the risk of debt distress, to give them favorable financial terms for specific fiscal activities in their country, infrastructure and all of that. If we should recover and grow at a sustainable rate, as you know, growing at 2% might be a recovery from recession.
Right.
But Africa needs to grow at a higher rate if we are going to make a dent in the 30 billion people that have been falling into poverty. An estimated 39 million people will fall into poverty at the end of 2021.
Absolutely, Prof. Now, can you give us an insight into the planned $3 billion vaccine intervention for Africa?
Please, can you come again?
Can you give us an insight into the planned $3 billion vaccine intervention for Africa?
Oh, yeah. Yes. Yes. So the bank is launching this $3 billion over the next 10 years for the health, what they call the health security for Africa.
Right.
The idea is to promote local domestic manufacturing pharmaceutical drugs, products in Africa. As you heard from me earlier, and as I'm sure you've learned now over this last couple of months,
yes,
having to import 90% of all your drugs, risk to the countries, is actually insecurity, the health insecurity. So what we are trying to do, and what the bank is trying to do, is to use this $3 billion to do several things.
Okay.
One is to support activities by all the other stakeholders like CDC. As you know, during the COVID, for example, the bank provided $28 million immediately to the Center for Disease Control for Africa. This will be building on it. We'll be having, for example, a foundation that will be engaged with technology transfer in the pharma area. One of the ideas of Dr. Adesina also.
Absolutely. Very well captured, Professor Oyelaron. Thank you for sharing your thoughts with us.
Thank you so much. Thank you for inviting me.
All right. Yeah, we've been speaking with Professor Oyeyinka Oyelaron of the Africa Development Bank. Weekly returns after this break with the Tidbit segment. Some African countries, especially South Africa, are experiencing a third wave in COVID-19 infection. Why is the spread defying efforts to halt the increase in cases? Now, this report brings us details.
South Africa has moved to alert level 4, the nation's second highest, from level 3 last year. The country experienced the Beta variant of the coronavirus and is now witnessing the Delta variant reported to be spreading like wildfire. The Delta variant, thought to be twice as contagious as the Beta variant, has now been detected in 5 South African provinces. Gauteng, which is the commercial hub of South Africa alone, now accounts for more than 60% of new cases in the country. The country so far has recorded more than total fatalities of about 60,000. Public health facilities in several provinces are stretched to their limits, and private facilities are also buckling under the strain. Even as the hospitals have made extraordinary efforts to accommodate patients, ICU beds are in short supply. Despite efforts being made to safeguard the capacity of the health facilities to cope with rising infections, existing containment measures in place are not enough to cope with the speed and scale of new infections.
The rapid spread of this variant is extremely serious. The 7-day average of new daily cases nationally has overtaken the peak of the first wave in July last year and will soon overtake the peak of the second wave we experienced in January of this year.
The priority of President Cyril Ramaphosa is to break the chain of transmission by reducing person-to-person contact. To this end, the country decided on some measures which took effect from Monday 28th of June 2021 through Sunday 11th of July. All gatherings, whether indoors or outdoors, are prohibited, and these include religious, political, cultural, and social gatherings. In the last week, the daily vaccination rate had surpassed 100,000 and have received an additional 1.2 million doses of the Johnson & Johnson vaccine and 1.4 million doses of the Pfizer vaccine through the COVAX facility. About 3.8 million people have been registered on the electronic vaccination database, while over 950,000 healthcare workers have now been vaccinated across the country in line with the national rollout plan. Ramaphosa is calling on South Africans to continue to wear masks, which are mandatory in public spaces. The return to stricter measures comes as South Africa faces criticism for its sluggish vaccine rollout, which likely contributed to the resurgence.
We now take you to Kenya, where the President Uhuru Kenyatta has ordered a tougher measure to curtail the rise in infections of COVID-19 ahead of the arrival of 10 million COVID-19 vaccines from the Johnson & Johnson's company in August to boost the vaccination drive.
With the fourth wave of the COVID-19 virus set to pick up this week, President Uhuru Kenyatta has issued new orders meant to cushion the country from the vagaries of the virus. In his Executive Order Number 4, President Kenyatta has ordered that travelers coming into Kenya possess a polymerase chain reaction PCR certificate before being admitted into the country. The test to ascertain one's negative status must be done 96 hours prior to coming to Kenya.
Acquired no more than 96 hours prior to arrival into the country, with the PCR certificate also having been validated by the trusted travel platform for those traveling by air.
And with the government targeting to vaccinate 10 million adult population by Christmas this year, President Kenyatta announced that 10 million jabs from the Johnson & Johnson's company would land in the country in August to boost the vaccination bid.
Using these vaccines and others in the pipeline, this is how we will vaccinate over 10 million Kenyans by Christmas of 2021 and 26 million Kenyans by the end of 2022.
The president calling on religious leaders and other partners to educate Kenyans on the need to be vaccinated against the deadly virus.
Although vaccination is free of charge and no one will be forced to get it, some education about it is critical. And I say so because by mid-2022, we have potential to reach herd immunity in which the danger of one infected Kenyan will not affect a community of people unchecked.
As part of government's long-term strategy, President Kenyatta has ordered the National Emergency Response Committee to begin the modalities of establishing a National Human Vaccine Center to develop and administer vaccines beyond the COVID-19 vaccines.
The national quest to produce human vaccines here in Kenya will elevate our nation as a producer for both human and veterinary vaccines that we currently supply to Eastern Africa all the way to Morocco in North Africa.
In the meantime, President Uhuru Kenyatta has extended curfew hours from 10 p.m. to 4 a.m. for another 60 days, save for the 13 counties from the Lake region, who will continue being under the 7 p.m. to 4 a.m. curfew. The other protocols announced earlier in the Executive Order Number 3 remain in place.
Now a medical doctor involved in handling of COVID-19 pandemic and the founder of Sanctuary Hand of Grace Foundation, Dr. Ngozika Johnson Obuneke, joins us via Zoom from the UK. Many thanks for joining us on the program.
Thank you.
Give us your assessment of the COVID-19 response by African countries with particular reference to Nigeria and South Africa.
Yes, I thank you, but you see, it says charity begins at home.
Right.
And because I'm home here in the UK, permit me to say a few lines about what we have had here in the UK. Then I'll be able to use that as a reference point to then see how well or not we've also done in Nigeria or in South Africa.
Right.
Initially in the United Kingdom, the COVID-19 pandemic actually took much of the government a surprise, just like many other nations. And to be frank, excuse me, the initial responses was a bit slow because people have not understood or come to grips how deadly the disease was.
Right.
And then we had a chance when Boris Johnson, the Prime Minister, had the COVID-19 infection, and he was treated in one of our London hospitals. So that was like a wake-up call to everybody to know that this disease, there is no discrimination on who gets it. It has no racial barriers. It has no economic or political barriers. And then there was a lot of tightening of the policies around it. Absolutely. They went swiftly to do a general lockdown in many places and restricted the movement of people, especially in the nursing and healthcare sector, in NHS, trust hospitals, and they stopped a lot of activities of hospitality businesses like the pubs and the football, where crowd could have been gathered. So when UK came into grip with that, there was then a lowering of the trend of the number of deaths. And people were now encouraged to use the face mask. So all these little things, observe your social distance, wash your hands, use face masks, and also be careful of where you're into and who you are meeting in order to provide contact tracing when needed. So this helps to, contain it until such a point as earlier this year when they now developed the vaccine, and they are using the vaccine to improve people's movement.
So talking about in terms of access to vaccination, where African countries are allotted few doses compared to the huge population, how can we achieve local vaccine production in Africa?
Thank you. I wrote one or two articles through Capstan television networks and their communications about COVID, and also about Nigeria's stand in encouraging people to take the vaccine. But I wasn't very happy initially that Nigeria, that is a country part of the COVAX team, in order to get the vaccine at a cheaper price, was now trying to spend a lot more money to say that they are going to purchase it. So I would have expected Nigeria to use that money to set up more COVID testing centers. Because even now in the UK, although they are controlling the COVID, the spread, and although they are vaccinating people, there is still weekly testing of individuals, of employers, of employees. And then let Nigeria emulate such situations so that we improve our hospitals and have more testing sites, and then improve the encouragement of people to use the vaccine. I am not, actually, in all honesty, I'm not a promoter of the current vaccine, because I have something against the method in which it was produced. It is an mRNA segment that is used to produce this, but it's a lot of medical jargons. But I am more in tune and inclined to support the traditional protein type of vaccine. And I'm believing that in future, when all this rush has gone over, that the scientists along the line will work on that and produce such protein vaccines. But seeing that this is what we have at the moment, I'll encourage Nigeria and the Nigerian government to please value the life of everybody, because every soul matters, every life matters. And if we are to encourage our communities, many people go to church or go to mosque or have meeting points, so let them continue social distancing, washing their hands, face masks when there's a crowd, and by all means, have the vaccine.
Yeah, what role can organizations like African Development Bank play in this regard?
The African Development Bank is actually a threefold organization. It has the bank itself, then it has the African Development Trust and the fund, and also it has the Nigerian Trust Fund as part of it. Nigeria always tries to play a big role in Africa, but I am disappointed, like many Nigerians, that Nigeria doesn't look inward in order to really see that charity begins at home. Now, Nigeria, since 1964, has been a major player of the African Development Bank when it was, formulated. In the same way that the bank knows to give people, loans in order to have businesses, somebody has to be alive, first of all, has to be healthy, before you start doing business. So the African Development Bank, as well as other banks, have a lot of role to play. We need to develop an opportunity to train people as COVID vaccinators and COVID information, teachers and COVID training centers. And under the umbrella of COVID, there are a lot of tropical transmittable diseases. So that African Development Bank, if we can set up tropical disease centers in many of the African communities and countries that are part of this organization, then they would have done a lot in order to structurally develop opportunities of enlightening our communities to have better health measures, to look after themselves. And people can also see those places as where they can get to when there is need for help. So
Dr. Ngozika,
they should not just limit the,
Yeah, so your NGO has been involved in health issues concerning women and children during the COVID-19 era. What impact is it making in Nigeria and Africa as a whole?
Nigeria is very large, but I continue to use that adage that charity begins at home.
Absolutely.
And in everything that I'm doing, I like the home front to always know what I'm involved in. Under the umbrella of the Sanctuary Hand of Grace, I've been involved with widows and women who are homeless, as well as helping children who are kind of like not able to pay their school fees. So these are the areas that I've been working through. And unknown to me, people were observing. And I think it was last week on the 23rd of June that the Virtuous Widows International Foundation, including myself and 4 other people, gave me an award based on human rights and also improving leadership role for women. Right. So these are the areas I'm looking at, because the woman is a beautiful garden. And I believe that when you make a woman knowledgeable and keep her healthy, you are not only helping the family, but you are helping the nation. So starting from the basics, the woman have to have access to healthcare and access to what is her right. So the areas that women are being marginalized a lot in Nigeria are in the areas of healthcare and in areas of the inheritance, either as single mothers or as young women or as widows. So Nigeria has to have a portfolio where the rights of the women are looked into. Right. Because when you take care of the woman, she will be in a good position to look after the children and also to raise children who will not be in the streets as bandits, who will not be in the streets as armed robbers, who will not be in the streets as people who don't want to fulfill their destiny or be of value to the community.
All right, so thank you very much, Dr. Ngozika Johnson Obuneke. Thank you very much for sharing your insights on the program.
Thank you.
All right. And that was a medical doctor involved in handling of COVID-19 pandemic and the founder of Sanctuary Hand of Grace Foundation, Dr. Ngozika Johnson Obuneke, joining us via Zoom. And that's where we end this week's edition of the program. Thanks for being a part of it. I am Joyce Ikogu.